Good morning. Welcome to an online event brought to you by Parkinson's Community Los Angeles. Today, we are talking about Parkinson's advocacy with jurist Dr. Julia Pitcher. I'm Patrick Lasasso, and I'm president of PCLA'S Board of Directors. For those who don't know us, we are a nonprofit that supports families living with Parkinson's disease through free events like this one, support groups, and more. Today's Let's Talk Parkinson's program is brought to you by our Let's Talk Parkinson's sponsors, Abbott, Boston Scientific, Kiowa Kirin, and Supernus, and by donations from generous people like you in the Parkinson's community. If you appreciate what we do, please visit PCLA.org and make a donation to help us continue this important work. Just a few quick notes before we start. We are recording today's event for our PCLA YouTube channel. You will only be visible in the recording if your video is on and you are asking a question. So please stay muted to minimize background noise. And after the presentation, there will be time for Q&A. And you can also submit your questions as you have them through the chat. Now, please join me in welcoming today's speaker, Julia Pitcher. Julia is the Director of United States Government Relations for the Michael J. Fox Foundation for Parkinson's Research, where she leads the first state government affairs office on behalf of the Parkinson's community. Outside of her professional world, Julia is raising two young boys who enjoy aerobatic feats that add to gray hairs. And while she's a former professional singer, her concerts are now conducted during carpool for non-paying small humans in car seats. Thank you, Julia, for sharing your expertise with us today.
Thank you, Patrick, and thank you, PCLA, for having me today. I'm so excited to be here. I am coming to you from the East Coast in Annapolis, Maryland, where it is a balmy 80 degrees and very unusual for this time of year, though I think you all are very used to this type of weather. I am not used to being a little misty at this time of year in February. I am missing some of those white flakes coming down right about now, but I'm so happy to be part of this virtual world where we can bring people together. I think one of the most interesting silver linings from COVID is the ability to be cross-jurisdictional and the ability to be active in politics and in the political process. Now with so many more options, particularly for those with living with Parkinson's, there's so many ways to be involved, and I'm so glad to be here today. So what you're going to hear from me today is a little bit about how, and then the what, and then the where and why what we're doing. So I'm going to start out with explaining to everyone a little bit about how you can be involved as an advocate and advocating on behalf of people with Parkinson's in your community in California, what we as the Michael J. Fox Foundation are currently advocating for in states, and then more resources at the very end, and then we'll end it with that with some questions. So we'll kick it right off to the next slide. So I like to start off with what you all are going to ask me at the very end. What type of resources are out there for advocates? Advocacy is a very hands-on process. Working with advocates and lawmakers is all key to success. Your voice, your story is the most important thing. You do not need to know single parliamentary procedure. You do not need to know everything that happens in your legislature. What you need to do is be your own voice and use that voice to advocate for things that in your community. The Michael J. Fox State Government Relations team has started to and will continue to host webinars. We are coordinating with various Parkinson's organizations across the country on both state and federal relations. We have an action center that is also state and federal. The link will be in this PowerPoint, which we can also send out to you all later with the direct link that you can catch up and read all about what we're doing. On that webpage, which we are starting to revamp and add more to as we go, will be things like legislative priorities, summaries on one of our proactive initiatives, and also how to engage your state representatives, which I'm going to talk about now. We'll go to the next slide. So engaging your state representatives is so important because these are the folks that you vote for on the ground in your communities that maybe you already know, that you may have already met your state representative, and that might be an assembly person or a state senator, and they are people that you might go to church with, or that you've met in the grocery store, or your kids went to the same school together, and they're real people, but it is very daunting because they are, have staff, and they no longer really, are in the community, but they're working with the legislature. But truly, what's the best thing that you can do? You just want to, again, tell your name, call up their office, email their office, and place that phone call to get in. And even a good old-fashioned letter. Folks still do read letters that come into their offices and respond. That's one of the ways that, everybody is so communicative. And knowing what your goal is. So obviously we're talking about Parkinson's and what we want to accomplish. And for most of you, you do know that there hasn't been a lot of an increased funding on the state or federal level for Parkinson's research in many years. And that's something that the Fox Foundation, in coordination and collaboration with other organizations, is working on to work towards bringing this to the attention of state lawmakers. So let's just say you want to talk about increased state funding for Parkinson's research in the state of California. So that that's your number one goal, and your initial outreach should be something formal. So you can email to your state representatives, and you can also find their information on both our website and also any Google search. If you put in "find my state representative," you will have a local California website that will take you to and find it based on your street address of where you live. So you start there, and it'll likely also give you your congressional representatives. But if you really want to get in where the sausage is made, you're going to send a formal request to that office, and you're going to ask them for a meeting. And these days, it's so easy to be able to meet on Zoom or Teams. But there's also something really special about if you're comfortable with meeting in person, and that is meeting them for coffee during interim, or if you live nearby them, or something that's connecting. Maybe you all, attend the same bowling league, and you can meet there and have, a drink and roll some bowls and get a chance to chat. A lot of times you will also start with staff. And just as a piece of advice, when you start to talk to state representatives, a lot of staffers are very young. This is a lot of times their very first real job outside of college, and they're incredibly motivated and so well organized, but know that they are young, and they're scrappy, and they're wonderful, and they're handling a lot of constituent issues, from mailboxes to transportation and potholes to the really large scale issues, environment and education, and also Parkinson's and healthcare delivery. So they have a lot on their plate, but if you're organized and you state your name, where you live, what issue you want to talk about, they will figure out a way to get you in a 15, 20-minute or 30-minute meeting with that state representative. Because your voice, again, you're a voter, your voice is valuable, and your story is incredibly connecting to lawmakers. They want to hear from you. They want to know how they can help when it comes to making policy. Next slide. So what do you need when you go into a meeting? Well, I always say that it's very nerve-wracking. Even I still get nervous after 20 years of doing this, of going into a meeting, of meeting somebody new, a new legislator. You just want to, remember that they're real people, and that they're there to do the work on behalf of constituents or behalf of organizations such as mine or yours. And be confident, go in, believe in yourself, know that your story is important to tell, be on time and be prepared. Sometimes it does help to write this down in advance of what you want to say, or if you're nervous, you can always jot a few notes in your phone or on a piece of paper, or even bring a family member or a friend with you. That way you feel very prepared when you get into the room or get in onto the virtual room. Depending on the meeting, again, be prepared for them not to be incredibly long. These meetings with legislators are usually pretty tight. They will have a block of time, what I consider constituent time blocking, outside of what are like committee hearings or session dates, or they're outside of legislative jobs. Many of them keep other jobs outside of being an elected official. So note that you may be given a 15-minute time block. So it's good to, say, hi, how are you? Get those, those introductions over with early, and then jump right into the reason that you're there today, and know that they are also, handling a lot of different issues. So you don't have one meeting, you can have a second meeting and our third meeting down the road. Sharing your story. This is the most important piece of your personal anecdote is one of the most important and most valuable pieces that you can speak to when it comes to the ask. So your lawmaker is going to say, well, what do you want? What do you need? And you're going to say, well, I am a person living with Parkinson's. Here's a little bit about my story. Whether you decide to focus on environmental exposures or whether you decide to focus on, I've been diagnosed young onset and this is how it's affected my life, or I've been having issues accessing medications. Or you can take some of the talking points that we can provide to you on various specific issues that we are actively advocating for across the country. And I'll get to that in a little bit. At the very end, you want to talk about any next steps, if there's going to be a follow-up meeting, if the lawmaker has asked to maybe meet with your support group or something like PCLA, and if they're going to be invited. Things like that, or if there is something further such as, oh, there is a bill that we are interested in, then you'll want to follow up with, we are advocating on behalf of House Bill 123. Thank you again for meeting with me on XYZ date, and, give them time to follow up and their staff to figure out, who's talking from where and what it is that issue and that connection. If there are other documents that you want to send that you know of that might be a PCLA document, it might be a Michael J. Fox Foundation, it might even be a Parkinson's Foundation document that you think they might want to have, go ahead and email it to them. They have tons of files on these things and they want to, they want their staff to be educated. All of these things are so important. Again, it can be such a wonderful connecting moment. So many of you know this. If you've met one Parkinson's patient, you've met one Parkinson's patient. What I've learned in the year and a half that I've worked with the Fox Foundation is every time I meet with a lawmaker in a different state, I make another connection and to the Parkinson's community. I can't tell you how many times I have met with a legislator or their staff and they have said to me, my family has been affected this way. And so trust me when I say that there are so many connections that you're all going to have. And that's truly your golden ticket. Next slide. So I'd like to start with explaining a little bit about where we are in the states. Obviously, California, quite a big state. You all have a lot happening out there, but it's always very important to know the political and lay of the land where we are right now. The end of 2022, we saw many elections. We had the midterms in Congress, and we had many new governors and legislative elections happening in November of 2022. And this is where we are. The light orange are Democratic-controlled legislatures. The dark blue are split control, which obviously there's just a few of those. And then we have a lot of Republican-controlled legislatures in the country. So this is the layout. So when you're looking at what's happening in the states, this is what you're looking at. And it's very important to just know what the landscape is, not just in your own state, but also across the country, because, a lot of different issues trickle across state lines and different lawmakers want to do different things. They also attend a lot of national conferences where they will get ideas. And some of those ideas are great, and some of them you might not want in your state. So it's always really important to hear what is happening across different states. We'll go to the next slide. So one of our major priorities this year are research registries, and I'm going to get into the details of this. And I wanted to highlight this today because in California, you all have the gold standard of a Parkinson's research registry that was passed in 2017 and further expanded in 2021. So this is the biggest issue that the Michael J. Fox Foundation has taken on a state level, working in various states. And you can see that where the states are with registries and where we're targeting are very diverse across the country. I want to give a little bit of background on that. So like I said, in 2017, the state of California passed a Parkinson's research registry. And what does that do exactly? That will collect patient population data from people living with Parkinson's in the state of California. And to date, last year's report that came out from California's registry is about 112,000 people in their system. And that's coming from hospitals and physicians and other entities. And that information is really helpful for people to understand data in the state of California, also for research institutions and universities to pluck that data to do additional studies. If we can get more registries like the California Registry across the country, we will be able to go back to the CDC, the Centers for Disease Control, and work with them on a federal program known as the National Neurological Conditions Surveillance System. You do not need to remember that name. It's a very, very long federal program, but just know that that is the hub within the CDC for Parkinson's and MS at this point, where there will likely be state data being sent to the feds, and then that will be accessed by researchers across the country and possibly even the globe to do more qualitative research that's substantive going forward, that we can one day hopefully get to a cure and potentially even prevent Parkinson's. So that's why this map is so important. Washington and Utah, you can see that they're in orange. They do have registries, but they are not fully functional as, again, compared to California. Nebraska is hashed in 2 colors. Nebraska has a registry. It is still on paper and using pharmacy codes. It's very, very antiquated. We are currently targeting them in this legislative session. We just had a bill hearing last week where I flew out to Omaha, and we have a bill to modernize their registry to bring it to the California level. And last year in 2022, we passed legislation in West Virginia and South Carolina. Their registries should be coming online either later this year or early 2024. So we count them in the they have registries category for right now until they're fully upline. The blue states, which also include Hawaii, we have targeted, and those are either advocate-led or with consultants or other contacts that we have in those states where we have proactive research registry legislation going during the 2023 legislative sessions. And the states, all 50 states are in session this year, and they will meet anywhere between the beginning of January till the end of this year. But the bulk, 40 plus states will meet between January and around May to pass their budgets and pass all policy related bills, including the Parkinson's registry bill. So we're hoping to get a few more across the line this year. Next slide. And this is a little bit about why we're doing these registries. This is also going to be available on our website, and we also have PDFs that you can download after this presentation. The data is going to help researchers study the patterns of Parkinson's over time, look in areas where there might be higher pesticide use and increases of cases, improve our understandings of the links between Parkinson's and military service, though that is a little bit of a federal and state barrier right now because the VA is administered through the federal government, but we're really hopeful again to fuse that together as we go forward. Everything is, one step at a time. And I'm going to go on beyond this to the next slide. Wanted to talk a little bit about 3 other topics that we as the Michael J. Fox Foundation are currently advocating for, which when you talk to lawmakers, you are more than welcome to talk about these issues with them. These are our 3 top issues that we are talking about with lawmakers across the country. And so we are encouraging you all. We're not gatekeeping any of this information. It's all going to be downloadable, and we're happy to help you with talking points and being trained to talk about this in your community. But there may be other issues that other Parkinson's groups in your community are other interested in, and we're also happy to help with that. One of the areas is environmental transparency, and this is very big in California. I know a lot of you all have probably seen in the news, that there's been a lot of linkages to neurological disorders with regards to environmental toxin exposure. And this is important to understand the magnitude and these risks that are coming and that could potentially be more in the future. However, it is very complicated and a little bit of a game of whack-a-mole, where if you want to go after one chemical, then another one pops up and then another one pops up, and you're trying to figure out a way to ban these chemicals, but also how do you then set up a system in place that you're not constantly going after something when another one that could be worse comes online or is available to market. So we are taking the approach of what we call environmental transparency, where we are going to start asking states to develop and publicly post on a website where toxic chemicals have been approved for use. So for example, Many of you know of the pesticide known as paraquat that is largely used across this country in agricultural industry. And what we would like to have is what we consider like heat maps or spot maps, where the states are required to at least say what area or what county has how many applications and put it in a user-friendly format, not some kind of spreadsheet that people have to, figure out the data from there. We want it very easy. And so that's something that we're going to start looking into asking states to do. We do not currently have a bill going in any states. But this is a new legislative concept that we're working and starting to have these discussions with newly elected lawmakers. Many newly elected lawmakers are younger and very progressive and are very interested in this subject. So it's something that will definitely spark a conversation. Next slide, please. This next subject is in several states right now. It's known as genetic testing protections. It comes from a federal law that was to prohibit health insurers from using information through genetic testing to deny coverage, but there are many loopholes on the state level. So we are supporting legislation that is being led by a coalition of organizations. We are one of them, where it's a little bit of a patchwork in different states. Some states have already enacted certain bans against denial or increased rates regarding life or long-term care insurance or disability insurance. But some have not done anything, and some are going for what I'm calling the trifecta legislation. So right now we have 5 states, Arizona, Florida, Maryland, New York, and Tennessee, that have these bills going, and we expect to see this subject coming up more in future years because this is an area where we encourage folks to get genetic testing for Parkinson's and many other disease states. Something that I think a lot of folks don't realize as well is completely separate from genetic testing for Parkinson's. Women who have babies after 35 typically are required to get genetic testing done, and that could prohibit them from being able to get coverage for life or long-term care or disability insurance later, regardless of any other disease state. So this has had some widespread effects to patients and varying demographics all across the country. And we really think that this is a terrible prohibition and utilization management in order to not insure or de-insure folks going forward. So we are working on these bills in these states. And if you know anybody in these states and you want to get involved, you know where to find us. We're going to go to the next slide. A huge issue that has come out this year, this is actually being led by the American Cancer Society, and we have joined in and are extraordinarily active in this going forward for the Parkinson's community. As you all know, there is currently no biomarker test available for Parkinson's disease, but there is so much research in the works coming from the Fox Foundation and many other organizations and through the science community. We are supporting legislation that would require healthcare carriers to include testing as part of their coverage. Many of them are going for the Medicaid programs first. Others are going for commercial or state regulated insurance in their states. So there's different bills in different states, but we are going to be heavily involved with that. And we've seen it in more than a dozen states already this year. Nothing has passed yet. Obviously, sessions are right in their meat of hearing bills, but we are hopeful to see several of these pass going forward. California does have a biomarker bill. We'll get that bill number to you all at PCLA. And hopefully, if you all want to engage, we do have a draft letter that we will be sending in. And then I'm hoping that other folks will come in and support this by contacting their lawmakers, because even though there isn't a biomarker for Parkinson's yet, we support this because when one comes online, we absolutely want there to be healthcare coverage for that test. Going on to the next slide. And we're done. So at this point in time, this is where we are with the Fox Foundation. And thank you for being here. There's different links. Like I said, all of our PowerPoints are going to be available to this group that has attending today. And we have the State Action Center where we have all of this information that's downloadable in a 1-page or 2-page form. And I'm so glad to be here today. It's just so wonderful to see so many. I know that the chat's been going, and I'm going to kick it back over to Patrick for questions and answers and going from there.
Julia, thank you so much. This was really phenomenal. Thank you so much for your time and the work that Michael J. Fox does is you just demonstrated how important your work is beyond the research to find the cure, right? We need to be. I think I went to Washington D.C. I think I can't remember what year it was in. I think maybe 2018 when Michael J. Fox and the PDF put together the advocacy lobbying program.
Yes,
which
we
was
had
really
the fly-in, the national fly-in pre-COVID
yes.
time. Yep.
Yeah, it was really, really wonderful. And one of the things that you touched on here was they were stressing that we really need, as a community, to become more of a squeaky wheel. And the work that you're doing, helping us become that squeaky wheel and make noise and reach out to our legislators, I think is great. And as you were talking, one of the things that sort of occurred to me, I've been doing this in the community for 20 years, and oftentimes you see couples that are really good partners. One partner has Parkinson's and the other is, really active and proactive in their care and their management. And I guess I just toss this out there. If our community, anybody on here, you could also consider teaming up with your spouse or significant other and creating a team to, go into the offices and you're locally, affecting the local representatives here, I think would be a really great, thing. And I could picture a lot of couples that I've met in the past really being good at it.
Oh, Patrick, I'm so glad you brought that up because that is so true. Couples, I had just had a brother give me a call, track me down that his sister has Parkinson's and he wants to get involved in Maryland where I live. His sister lives in Massachusetts where we're running a bill. So we're going to have their team, even though they'll be separate, they're going to be helping each other out in 2 states. So it's, a 2-for-1 deal there. Yeah. But I totally agree with you. One, it's very helpful if you're uncomfortable going by yourself or if you are experiencing an off day to have somebody care person with you, but also, the power of 1 versus 100, bring a friend. The more people, the merrier, the more that can make noise and be an advocate and work for the community, the stronger your voice is always going to be.
Yes, absolutely. And I did experience exactly what you talked about coming into the offices. They teamed us up and we would go into the different legislators' offices and meet with the staff. Sometimes the actual legislator, but bringing a friend in with Parkinson's, having them tell their story was really, really effective. And like you said, I don't know what the numbers, we don't know what the numbers are. They have to be more than what we hear, because almost every meeting, someone we were meeting with said, oh, yeah, my grandmother had Parkinson's, or it was the exception when someone didn't have some sort of connection to the disease.
You're right. And the Parkinson's Foundation and Michael J. Fox Foundation just went through a study this last year that came out in December, which we're happy to also send out, where the estimated numbers are far more than we ever expected. That typically it's about 60,000 per year being diagnosed. We now estimate it at 90,000 people per year. And that's just huge. And we, with an aging population, with more veterans that are aging up after fighting abroad in the early aughts, I think that there's going to be so many more, unfortunately, people diagnosed in coming years. And we really have to get a grip on that. We have to get better numbers from the CDC when states have registries. We just have to really push lawmakers to ask their states to do more for the good of the public health, truly.
Yeah, absolutely. So I'm looking here, requiring biomarker testing. Is there a concern about discrimination for things like life insurance, et cetera, related to GINA until we get greater anti-discrimination laws passed? So I guess, is there a concern about pushing for these biomarkers before we get ensured that those biomarkers will not
we also
prevent us from getting.
I think a lot of this is happening at the same time. So some states have protections against discrimination beyond the federal GINA one, which is just health insurance. Some do have protections against discrimination on life, long-term care and disability. Some do not. So that's why there are some bills floating around to close some of those gaps. And that's why we are supporting of those, because we really think that it's unfair for any person in any disease state that has any type of genetic testing done at some point in time in their life, that by the time they go and they find out that they are going to be, have astronomical rates or just not get insured, is a huge discrimination piece that should not be, that it's predatory practices by the insurance carriers. And that's something that we want to stop.
Yes. Sparky, I remember going, she wanted to share an experience. Remember going as a group with the Sierra Club to meet our representative many years ago. There seems to be power in numbers.
Mhm.
Yeah, and that's kind of what we're talking about, creating that team.
Mhm.
If it's just a couple, I mean, we can really affect a change on the local level.
Absolutely. And we can collaborate in things like a full-scale Parkinson's Advocacy Day, which I don't know if that's been done in California, but it's something that we could all collaborate together on. Maybe not this year, maybe next year or future years as we can get this going, where multiple Parkinson's organizations come together, maybe in April during Parkinson's Awareness Month, and have a Hit the Hill Day in the Capitol. Or you can have a digital virtual day. We could do these types of things to really bring forward the power of numbers together. And that's really what that's one of the reasons one of our offices started, is to be the voice, but also not the only voice in the room, because we want to collaborate with our friends in different states and different organizations, because we all have a piece of the pie and a part of the community.
Well, I'm pretty confident when I say that, we would be happy to, continue the conversation with you and partner up for those types of events in the future. I'd like to open it up to our group here. If you are familiar with Zoom and you know how to unmute yourself, and if you have a question, go ahead and do so, and I'll kind of review while we're waiting for that. Deborah, it looks like you might have taken yourself off.
Yeah, I was the person who asked kind of inelegantly the question about basically chicken and egg, about the biomarker, and I'm not very well versed on it. So, but is there, are we going after the protections first, and then in the states that have already acquired protections, then go after the required the required biomarker testing? Because I want to make sure that we're not pushing for the testing and exposing people to discrimination.
Well, and that is a great question, because it's not an automatic discrimination. So let's say, I'm just going to pick a random state, Oklahoma, and let's say they don't have the protections against the discrimination when it comes to life or long-term care insurance, but somebody gets a biomarker test for cancer. It doesn't mean that the insurance carriers would automatically deny or restrict or increase coverage premiums. It just means that they could. So really, it's really a both. So we can't really just say we don't want to go for biomarker testing and then until we do X. So, and also because it's a joint coalition with multiple organizations, as the Parkinson's community, we don't even have a biomarker, but we are supportive for healthcare coverage for the other disease states that do have one, in hopes that one day we will. But we are very active also on that genetic testing discrimination piece, saying, look, this is a very under the radar issue and people don't even know about it until they ask for it, and they could be denied coverage or, again, restricted or increased premiums. So we want to make sure that we're loud in our support for saying you can't continue these kinds of practices.
Thank you.
You're welcome.
One of the things as you were presenting, I've heard about, and it was very encouraging, I thought, was the fact that this mission crossover between like the Alzheimer's foundations and the Parkinson's foundations, where we have common goals, and it's encouraging to know that that we're working together with other organizations. That I enjoyed that. But
the way I look at things, I've been in government relations for a long time now, and lobbyists and lawmakers, we can spar like the best of them. It's like going into just WWF wrestling ring sometimes, but really at the end of the day, we're all trying to get the same job done. And when you open that up, and you may sometimes have conflict in certain areas, or maybe but there's really truly overlap in so much of advocacy in neurological disease states and working together for the greater good. One of the reasons that we're so supportive of the California Parkinson's Registry is because of the fact that after we were able to get that done in 2017, it's been expanded and we fully supported. It's going to be adding, not right this second, but it's going to be a phase in over the next 3 years. It's going to add in Alzheimer's, MS, Huntington's, and that is so wonderful that we didn't want to gatekeep or say, no, this needs to be just Parkinson's. because we're the only disease that's out there. No, of course not. There could be, you know, genetic predisposition for both for different folks across the populations. So we really do want to work with our brothers and sisters and other organizations, particularly in the neurological space, so that we can all come together on better research, better quality of life, better therapies, and ultimately maybe cures. Because truly, when you share information, and the Fox Foundation is very open with their science and sharing with other organizations, because we see that as, you know, you can't exist in science in a vacuum.
You know, it's interesting. I think as I became more acquainted with what advocacy work is, it's diverse, it's dynamic. We are trying to move legislation forward. We are trying to raise funds to increase funds for research to the NIH. NIH makes, I think they are the ones who really kind of make decisions. They get the pot of money and they decide what funds go towards what research. Do you have information on that? And I think that's part of the reason they were telling us that we really got to be the squeaky wheel. And, you know, Michael J. Fox raises money for research, but then there's also the NIH governmental programs that raise money and then decide where to put this research. And can you speak to that a little bit, and how we can funnel more of that equity, more of that research towards Parkinson's?
Sure. No, this is a great question, Bruce, Patrick. That one, the NIH is usually responsible for early stage research. So they're doing the baseline, I would call it like the first group project on the issue, whatever that issue might be. And they receive money from Congress. So that's a federal issue. So you want to write your congressman, man or woman, and your United States senators about funding. And that funding has not increased in 20 plus years for Parkinson's. It's around $180, $85 million per year, which is a drop in the bucket. And again, this is not an area where I want to compare in an adversarial way, but Alzheimer's receives around $3 billion. So when you're looking at 185 versus 3 billion, we really do need to up ours more. And I think that they would probably also be very supportive of that for us as well. But that's where on the federal side. So you have to increase the money coming from Congress that funds to NIH, and then that goes out from there. And additionally, supporting groups, again, like the Fox Foundation, we are a charitable foundation that, you know, we've been funding close to 1.5 billion in the 22 years that we have existed, as well as in 2023 into 2024, we're expected to fund about $350 million in research across the globe. But again, that needs to be told to lawmakers that wouldn't it be great if there's a state fund for Parkinson's? Like, why can't we create it? You have some of the greatest hospitals and medical universities in the country in your state. We could collaborate on going to the state legislature and creating a fund for Parkinson's, a state fund, getting the governor sign off. It would be, you know, $25 million a year. Why not? You know, to get that started. It has been done before. There's I think it's called something called like the cancer moonshot has been done in a couple of different states. ALS got about $20 million in Minnesota last year to start a regular fund. We can work on that, but it is an unfortunate thing where you do have to get very loud with Congress and keep coming to them to ask for them to fund more research in the NIH piece, and then also working with local universities to really get them on board.
Is there a use case example of a fund that we could look at to model what that would look like here in California?
A little bit, yes. Two, I would go with. One, the Alzheimer's plan, the Alzheimer's Foundation plan to end Alzheimer's from the 90s. That's how they increased federal funding, and that was a federal effort with their national organization. And that is something that we are working on doing as well. Our federal team put forth last year. It did not pass in Congress, but we're reintroducing it hopefully in the next month. It's called the National Plan to End Parkinson's, and we are doing taking a page out of the Alzheimer's book and putting forth requiring the federal government to bring together a nonpartisan clinical advisory group to study and come up with a plan and then fund that plan over the next 20 years. So that's one that you can look at. So the Alzheimer's plan could be tiered for a state. And then also, again, in Minnesota, in 2022, there was $20 million set aside in the state budget to create pardon me if I misspoke, an ALS fund. And that was also done through a champion. I think there was a legislator who was closely connected to ALS. And again, that isn't a bad or an adversarial thing. It's just, you got to find the more you talk to lawmakers, the more you're going to meet people who are affected by Parkinson's. And when you find somebody who is truly a believer in the cause, they can get something across the aisles.
Okay. So PCLA is a nonprofit. We've been around for 6 or 7 years now. And we've been talking about, first of all, thank you for joining us today. I'm not wrapping it up yet, although it might sound like I am, but I wanted to thank you because we've been wanting to add advocacy work to our arsenal. We're small. We have 9 board members. We have 1 part-time employee, 1 full-time employee. So, you know, we're struggling. We have a shoestring budget, but we like to think we accomplished quite a bit with what we have. I wanted to throw this out to the group here. If you're interested in maybe teaming up with some local folks here, we could create a PCLA advocacy group, and I'm sure Michael J. Fox would partner with us and give us the tools and the skills and the direction. So for those watching live, and this is going to be up on our YouTube channel, which, by the way, has some amazing content. If you don't know about it, it's part of the pride that we have in terms of the work that we have been able to accomplish, especially during COVID. Check that out. Reach out to us through our website if you want to join the PCLA Advocacy Team. I think that our board would really support moving that forward and partnering with you. So Deborah says, yes, and based on what Julia said about genetic testing on pregnant women over 35, it seems we have some overlapping interests with women's advocacy groups. It's just a comment. I wanted to read that.
No, I saw that in there. I think that would be a great place for us to start talking to more folks. I was blown away. This actually came from the Genetic Testing Coalition that I was part of a phone call with earlier this year. And there was a geneticist from Johns Hopkins University on the call, and she said that has been something that has been very difficult for her when she's advising pregnant women, you know, to get genetic testing, but then also when it comes to other disease states, et cetera, that this can affect other people at all ages, and that, you know, diseases don't discriminate. And yet, you know, here we are, we have organizations that you're supposed to be able to go and buy life insurance later in life to prepare to, you know, the rest of your life. When you find out about a diagnosis early on or anytime, it's really, really important. And the fact that, you know, having genetic testing in order to, you know, to protect your pregnancy could be then used against you later. I do think that there's a lot of overlap that we could be talking with the Parkinson's community and the women's advocacy groups, truly.
Absolutely. Let's see, Bruce, you took yourself off mute. Do you have another comment?
We have to recognize, I think, that we're dealing with a situation that is causing a lot of emotional turmoil for all of us, whether we recognize it or not. And we're going through the different stages of that emotional turmoil depending upon where we are in the pathway. I think it would be really important to advocate for mental health advocacy for not only for the individual who is dealing with Parkinson's, but for the caregivers, the care partners. For example, I said to our neuromotor disorder specialist, when she was addressing one of the problems that I brought up, she did not address it in the direct way that I had asked for. And in response, I said, you have to recognize that I also have Parkinson's. I just have it in a different way. And so I'm not suffering from the specific illness, but I'm suffering from all the issues that a devoted care partner would deal with. So mental health, I think, is a critical issue. I also agree that The other neuromotor disorders are important. Some of them have no advocacy or very little in the same way that we do. So there's an opportunity for a coalition there.
Thank you. I'm so glad you mentioned that. And again, I wanted to say so sorry for your wife's loss recently, and just, that's just heartbreaking. And so my thoughts are with you and your family. When it comes to, you're right, mental health. I didn't highlight that in my presentation today, but that is part of our social determinants of health platform that both our federal and state team will be supporting. Telehealth, access to telehealth, and telemental health is so critically important, particularly during COVID and since COVID, and as we move forward, that it's such a wonderful way, particularly if you live in rural areas or you lack transportation or you don't have a care partner who can get you to and from appointments. Being able to access a provider to talk to is critically important. And so we are very supportive of all the federal and state telehealth and mental health access. We are always supportive. We would love to get more providers in the pipeline, young students going into the mental health community. I mean, if I had a pot of money, I would absolutely just put it right at those college students and get them into more primary care and more mental health if I could. But you're right. And I'm really glad that you brought that up on this larger platform. And there was a second thing that you brought up, and I'm not sure if I addressed it.
Well, it was the coalition of other neuromotor disorders. But I wanted to say, let me just clarify on the mental health issue. The patient or the individual who has the Parkinson's has specific issues related to both the Parkinson's and whatever other mental health issues they carry with them that are exacerbated. But the same thing goes for the care partner. And speaking as a care partner, all the various things that I went through in terms of stress leading into distress, functioning on a margin of lack of energy, lack of sleep, and sometimes in the negative margin, the risk thereafter, because if I was not thinking clearly, what was the risk I would make a mistake in administering medications and so on. So the care partner has these issues. Now, we were really lucky that we were working with a specific psychologist who is both a geriatric psychologist and a specialist in neuromotor disorders. And so we had absolutely direct attention to these issues. Not so many people can find someone like this, but the bottom line is advocate for more specialization if possible, but more so just advocate to get more mental health folks involved. At least they can work on the issues like depression and so on and so forth. So that's where I'm going with that. I have much more to say, but I'll do it.
Yeah,
Bruce, thank you so much for putting a spotlight on a primary reason we started PCLA, actually, was that and when I first started this work, they weren't talking about the fact that Parkinson's affects the whole family, not just the person. And care partners need to manage and care for their own mental health and stress as well. That's why we have a care partner support group. And I'll just throw that out there. If you're a care partner or if you have someone, that person needs to manage and care for themselves as well. So it's, it's much more common to hear about that, but it doesn't get spotlighted enough. And I know it was a little off topic, Bruce, but I think that it was really a wonderful thing for you to bring up again. So thank you. We have only a few minutes left. So unless there's any last questions here, we'll start wrapping things up. So as I had said, I think we'll continue this conversation, Julia. We'll reach out to you, and I'm hoping that we can put together an advocacy team. I know that we've got already, I'm pretty sure we'll be hearing from a couple of the folks on here who would like to participate.
I love that. I think it would be so great. Advocacy, I mean, of course, I'm going to always advocate for more staff, but, volunteers is truly where it is, just a couple committed folks to be willing to, write legislators or just speak out or send an email to their other colleagues, and we can help give you those tools and toolkits on how to do it, best practices, and then also just happy to come back and speak anytime. It's just wonderful to be able to do this 3,000 miles away from each other, but feel like we're in the same room and get things done, because truly you all, you're the boots on the ground in California, and I really can't wait to work together in the future.
All right. So thank you again, Julia. And thank you everyone here for joining us today. We're excited that PCLA has been chosen as an official charity partner of the LA Big 5K race, which is part of the Los Angeles Marathon. You're invited to join us in person or virtually to help us raise funds for our support and educational programs for the community. We have some great events coming up as well. Join us next month and learn how to meal prep for Parkinson's and how you can contribute to one of the largest PD research studies in the world. We will also learn about a new treatment that targets off times. Links to register for these events, as well as updates for our programs, will be sent out to our email list. So if you're not on that, please sign up. Today's event was made possible by our sponsors, Abbott, Boston Scientific, Kyowa Kirin, and Supernus, and by you. By donating to PCLA, you can join us in our mission to improve the lives of families in our community who are living with Parkinson's, like programs just like this. PCLA is a nonprofit, and all donations are tax deductible. If you enjoyed today's programs, please consider donating at PCLA.org to help us continue to provide programs like this for free. And as always, reach out to us with questions at info@PCLA.org or by phone at 310-880-3143. Thank you all for coming. Thank you so much.